Good evening, Los Angeles, and thank you once again for joining us for this nightly update on COVID-19 and our fight against this crisis in Los Angeles. Thank you for joining us here at City Hall. We're in a new month, and usually this would be a day of fun and practical jokes, but we know that this has been no joke, and that this will be a very tough month in our cities and our nation's history. I've always promised to tell it to you straight here each night, and I thank you for letting me spend some time with you and your family to be able to share the data and the actions that are important to you and to our lives in the coming days. We all know this challenge that we face is unlike any that we have ever faced before. But I want you to know that every single day, my confidence that we will get through this together grows and grows. When I see the acts that people are performing out there in the city, when I hear the way that people are coming together, and when I see the discipline with which people are living their lives, difficult but necessary actions to save lives and to protect our city. Through the good days and the bad, I want you to know I will always be right here with you, leading an amazing cadre of public employees who are out there with frontline workers and volunteers who are risking themselves to protect all of us. And right now, you can be part of that team, doing your part, saving lives in your family, your neighborhood, your workplace, by making sure there are no exceptions to the rules. There's no time you let things slip, and that we wait till public health officials, nobody else, says that it's okay for us to let up with what we are doing. Let me start with tonight's data snapshot before moving to announcements and updates on our ongoing work. Today in Los Angeles County, we heard there were 507 new confirmed cases of COVID-19, bringing the total number of cases to 3,518, a 17% increase over yesterday. To put that rate of increase in perspective, county cases here in LA have doubled since Friday. In the city of Los Angeles, there were 194 new cases, bringing our total to 1,580, a 14% increase in the City of Angels. Additionally, and most difficult, there were 11 new deaths. This brings the total number of fallen Angelinos to 65, a 20% increase over yesterday, and the number of deaths have also doubled over 4 days. That remains steady over the past several days. As always, my heart goes out to those who are mourning tonight. And one of the cruel things about this is that we have to mourn by ourselves. We can't be with one another. We can't hold and hug one another. But know that each one of us wrap our arms of love around you tonight. In cases per capita, we remain about 14 days behind what we see in New York. In terms of the deaths per capita, it's about 11 days behind. And yesterday, the Centers for Disease Control and Prevention changed the period of exposure risk for COVID-19. What this means is that if you are symptomatic, you must now notify anyone you came into close contact with starting 2 days prior to the onset of those symptoms. So don't just think about where you were when you started feeling sick, but think backwards 2 days before. Contact those people. Let them know so that they can quarantine, isolate themselves, and we can stop the spread and knock down this curve. We're continuing to expand our testing. Numbers are constantly shifting as we have scaled this effort. Today was a great day in which 2 more testing sites opened up in the county. Another one will open up tomorrow, and a walk-in center as well. And I'd like to lay out the extent which we've ramped this up in the simplest terms. Last week, we were providing 1,000 tests a day, a huge increase from just a week before. But our goal was to double that and to get to 2,000 tests a day by the end of this week. We've hit that target ahead of schedule. We hit that today. And that's possible because, as I mentioned, we're rapidly adding testing locations. Your county, the city of LA, other cities, some private providers, as well as clinics have now got more tests than we've ever had before. And this week, thanks to our partnership with the county, that overall number of drive-through centers has increased to 9. in addition to more than a dozen locations specifically serving the homeless and our senior communities. Big picture, what this means is simple. Yesterday, we had completed a total of 10,000 tests. By next Wednesday, we'll triple that number and we'll have completed a total of 30,000 tests. And that's a conservative estimate without accounting for potential federal testing assistance, which we badly need and are awaiting. Every night, my team sees a slight uptick in signups for testing as I share these numbers. So as always, I encourage you to sign up or see if you are eligible. Go to coronavirus.lacity.org and see if you're eligible to get tested, and if slots are filled for one particular day, you can make a future appointment now. We all want to stop the spread of the coronavirus. Physical distancing, isolation, and tonight I want to talk to you a little bit about protective face coverings. Some of the places with slower rates of spread, from the Czech Republic to Taiwan and South Korea, are reminders that tackling coronavirus depends on not spreading respiratory droplets. And let me be clear, we have two different groups of people when it comes to facial coverings. First, there are the frontline workers. These are first responders, doctors, nurses, medical technicians, and we're working with logistics companies and FEMA to secure the masks and the personal protective equipment they need to serve all of us and to protect their lives. This includes face shields and gowns. And when the crisis gets worse, the last thing we want is for them not to have the life-saving equipment that they need so they can keep saving our lives. But there's another group of people, and that's the rest of us, those who are going to the grocery store or to the pharmacy to pick up your medicine. We must protect folks that we come into contact, like our grocery workers, our delivery workers, and other non-medical essential workers when we interact with them. And early data suggests that folks who are infected are not symptomatic, which is why, with today's guidance from Governor Newsom and Dr. Ferrer from County Public Health, we are now recommending that Angelenos use homemade face coverings when they are in public and interacting with others. To be clear, you should still stay at home. This isn't an excuse to suddenly all go out. You need to stay at home. But when you have to go out, we are recommending that we use non-medical grade masks or facial coverings and not take the ones that are reserved for our first responders. This is an N95 mask. It doesn't just come in green. You see them in white and other colors. But this is what we need to protect for our medical workers. Do not take them from them. And in fact, we've had heroic people driving across Los Angeles County with motorcycles and pickup trucks who are going to folks who are donating 1, 2, 10, 20 of these masks to make sure that that night a nurse or a doctor or medical technician will have masks where they are working. This could save or cost a doctor or nurse their life. So we need to protect them for them. So I repeat, please do not get medical grade or surgical masks or these N95 masks. We must not contribute to the shortage of these essential personal protective equipment for medical personnel and first responders. But other coverings like this, which can be made of different materials that we can wear in public, research shows even a bandana tucked in can have an effect of slowing down droplet spread. These face coverings are only effective together, of course, with safe physical distancing. So this is not an excuse to get closer. But this is a creative city, and so as I announced last week, we've been working with some of the amazing companies and people in Los Angeles to share ideas on how we can make sure more of these are available for all of us. And many of you are making them at home or ordering them. And we want you to share those stories with this hashtag, LA Protects. LA Protects is all about making sure that our medical personnel get what they need and that the rest of us can do our part to stop and slow the spread. This hashtag is a deliberate choice and aligns with my LA Protects manufacturing initiative, which is already yielding results and producing non-medical masks destined in short order for grocery store workers, for non-medical staff in hospitals, and others providing essential services during this crisis. To make this process seamless, the LA Protects initiative matches approved manufacturing companies with essential industries that are in need of masks. So far, 400 garment and apparel manufacturers with some of the greatest sewers in the world and the equipment right here in LA have signed up to make cloth face coverings, and 147 of them have already met our requirements. They're licensed garment manufacturers located here in Los Angeles, and they have agreed to implement public health protocols to protect their workers. And tonight I can announce that we have the capacity to manufacture more than 2 million cloth face coverings per week. And with 99 essential businesses that have already reached out in need of that protective gear, LA Protects will match that with those companies and workers that need them to help us all slow the spread. This is proof of what can happen when we come together and work together to make sure that this crisis is not met by anybody alone, but all of us together. Our government and private sector see a need, and we've united around action to fill it. And I'm so grateful for everyone involved in this effort. The donors to our COVID-19 crisis fund, the workers on the shop floors who are helping to save lives, and our LA business ambassadors who are visiting these sites to make sure everyone is abiding by the highest standard of public health and worker safety. And if we can keep this going, so if you are working in an essential business or you're coming into frequent contact with others and you need non-medical cloth face coverings, we're here to help. So sign up for this program at coronavirus.lacity.org/LAProtects and share your face covering stories, pictures with that hashtag LAProtects. There's another component of LA Protects that proves the power of partnerships and our city's trademark spirit of innovation and creativity. And I'm proud to announce that we are mobilizing our architecture, design, and manufacturing communities to utilize 3D printing technology to produce personal protective equipment for healthcare professionals standing front and center in this crisis. We have designs for face shields ready to print. We'll begin matching up hospitals in need with architecture and design firms and other companies with this printing capacity so that we can make these in bulk, on top of companies like Wet Design that I mentioned the other night that are retooling their assembly lines to make sure our doctors, our nurses, our medical professionals are safe. And we're getting this done by tapping into the resources on our own backyard, developing prototypes and designs with USC's architecture, engineering, and medical schools. We're working with UCLA, see, we work both sides of town, and other local universities and design schools and architecture firms to utilize their materials and to use their expertise. This program will only grow in coming days, and we'll share more of it, but it is protecting our frontline workers with other products as well, like 30,000 liters of hand sanitizer for grocery store workers who had no hand sanitizer, made right down the street here in downtown by Green Bar Distillery. As more of these ideas and designs turn into products, we'll be able to protect our critical workforce and save more lives. And I just want to say thank you to everybody who is a part of this heroic effort. Slowing the spread of this virus and flattening the curve on new infections demands that we all do our part. And that's the bottom line. Yet still, some non-essential businesses continue to operate, putting everybody at risk. All of us, the employees, customers, neighbors, and a failure to comply with these measures and to heed warnings to close will result in a misdemeanor charge. 4 more were referred today by the Los Angeles Police Department on top of the 4 I announced yesterday, bringing a total of 8 criminal charges that we have referred to our city attorney, 4 companies that are violating this. This is serious, and we cannot allow violations to continue. So tonight, I'm directing the Los Angeles Department of Water and Power to shut off the water and power for those non-essential businesses that continue to stay open even after they have been warned to stop operating in violation of the Safer at Home order. No one wants to take this step, and we won't have to as long as you follow the rules and protect yourself and protect all of us. Finally, let me share a few updates on some of the initiatives that are helping us meet the needs of all Angelenos during this crisis. We're doing everything in our power to help businesses weather this storm. For many folks, keeping the doors open right now means making major changes to the way that they do business, because we're all doing what we can to keep people in our city healthy and safe. This includes farmers markets, which I spoke about last night. These markets help maintain our local food supply, and local growers rely on them to keep in business. That's why I've taken action to keep farmers markets open while maintaining the highest level of public health. We suspended them, but asked them all to come forward with a plan and to submit a COVID-19 operational plan for approval to our Department of Street Services. And many have. Tonight, just 24 hours later, I'm pleased to report that it's working. As of today, our Bureau of Street Services has approved plans for 24 farmers markets across our city, and they are approved for immediate operations on the days that they are scheduled. Some of them were even operational today. Every market's plan must enact new measures to protect vendors and customers from exposure to the virus. That includes separate entrances and exits, systems for physical distancing, in lines and in the main thoroughfare, and limiting the number of customers in the marketplace at any one time, hand washing and sanitizing stations, and clear signage requiring customers with any symptoms of COVID-19 not to enter the marketplace. Vendors at markets will move as much as possible to online ordering and will maximize use of cards instead of cash. And if cash is used, measures will be taken to eliminate cross-handling of cash and food. All food will be out of reach of the public, and customers will not be allowed to handle any food. And as much as we love our free samples at the neighborhood market, they will not be permitted temporarily during this time. I know these precautions sound strict, but as long as we continue to face this public health emergency, they will be necessary and they will be enforced. The Bureau of Street Services is working with organizers, reviewing new plans every day, and I hope that all farmers markets in the city will be up and running soon. So to check on the farmers markets that have approved plans, visit streetsla.lacity.org/COVID. That's streetsla.lacity.org/COVID. If your local farmers market isn't approved yet, please encourage them to visit and to submit their plans at specialevents.lacity.org/home. Many restaurants have also made creative changes to keep afloat, and I know how difficult it's been. People who I've talked to who for years dreamed of owning a restaurant, built and sweated to get there, are seeing everything look like it could evaporate in front of them. We've made those changes to help them, like the bars now offering pre-made cocktails or the Italian eateries selling their sauces wholesale. And changes like this are vital to keeping many restaurants in business right now. That's why the County Department of Public Health will now allow restaurants that offer grocery-type products to include them on their menu for takeout and delivery. So think about your local restaurants, and if you need to pick up some basics and you know that they sell them, order them from our restaurants too. This could be the lifeline that they need to stay afloat. And they're able to sell these grocery products for delivery and takeout, and that's the kind of ingenuity that we need right now. We need to think about anything we can do to get ourselves through this, not just our health, but the health of our economy as well. Every day I'm reminded about how people in Los Angeles are coming together to help one another. Across our city, our state, our country, people are coming together to help one another, like Bruno Vasquez, who donated $5 to the Mayor's Fund program that provides relief for struggling families. And when we asked him why he donated, he said, "I wanted to help people that might not have access to funding. I'm self-employed. It's not a lot, but I hope to give more." Thank you, Bruno. You remind us that we are all each other's keeper, and that each of us has an equal stake in this fight. What that means is that if I do the right thing today, it might save your life tomorrow. But this only works if we're all on board. This virus doesn't care who you are or what zip code you live in. It doesn't care whether you're a Democrat or a Republican. That's why I was pleased to see that the governor of Arizona, a Republican, and the governor of Nevada, a Democrat, both neighboring states, and the borders between us are nothing more than an idea, that they both issued safer-at-home orders in the past 24 hours. Thank you for doing that. Our neighbors and their efforts to protect and ensure the public health in their states will help us stay safe here in Southern California. It's why I also join many U.S. senators who are calling on the IRS to send stimulus checks to seniors automatically, rather than requiring them to file income tax returns, an unnecessary barrier to getting them the relief that they need. This crisis has already shined a light on what we knew, that our fates are intertwined, that my health depends on your health, and that we are only as strong as the most vulnerable among us. And that is the principle that has guided every decision I have made during this crisis. It's what we must remember as we make difficult sacrifices, and that is why I ask us all to stay safe, stay healthy, and stay at home. Strength and love, Los Angeles. Thank you. And I'm happy to answer questions. Take the first question.
First, we turn to the line of Robert Kovacic with NBC News. Please go ahead.
Hi, Robert.
Mayor Garcetti, how are you?
I'm doing okay. You?
Good, thank you, sir. Listen, can you offer any more details regarding the deliberate derailment of that train near the USNS Mercy, and if it's going to impact anything regarding that ship, including a timetable? Also, you just mentioned those non-essential businesses specifically facing criminal charges. Can you tell us which businesses they are?
I can't, and I'll check whether I'm able to. I can't because I don't know them offhand. I'll check whether or not that can be shared. And we certainly want people to know that we are coming after folks. We want to know the type of businesses and maybe even potentially name them. But let me follow up on that. In terms of the derailment, no, that shouldn't in any way change the operations. We still have vehicle access. We can get folks in and out of there, and they have been accepting patients. I've gone down there. It's a little bit away from the tracks. It's close by to the tracks, but that shouldn't stop what is happening. We need to continue having non-COVID-19 patients. It started, I believe, with VA hospital patients who have been either discharged who've been transferred to the USNS Mercy, and they have, I know now for 3 days, been accepting patients in there. Thank you. Next question, please.
Next question, please.
And next we turn to the line of Conan with KNBC TV Channel 4. Please go ahead.
Hi.
Hello, Mayor. Listen, the president today at his briefing said that the White House is looking into the potential of eliminating flights from hot spots to other various cities. I'm wondering, would you support that if you were, and is that a concern to you that LAX is receiving flights from places that are seeing a sharp increase in the number of cases and deaths? And could that even incrementally help with the fight against the outbreak here?
It certainly could. I think we need to have really good screening before people get on planes so that we don't have to worry when they are arriving whether or not they might be sick. And we have to have secondary screening. Usually that's on the federal side of the line before it comes to us. At LAX, we own the airport, but the federal government controls the security side of operations, and certainly for international flights. Second, though, I would say a lot of people have talked about this. Most experts I talk to say this is not about excluding people from anywhere anymore. Look at every country that's wanted to do that. Mexico wants to exclude Americans. The president talked about closing off the border with Mexico. Certain states have talked about hunting down people with license plates in some of the hotspot areas. The biggest threat is the spread that's already here. It is here. It is no longer something that can be prevented. But as we make progress later in the future, absolutely. We want to, I think, minimize any contacts from hotspot areas. We're seeing that in Asia, in places that did knock down the curve, and in some cases almost having no new cases, that they're seeing the new cases that are there are people coming back. But I don't think we should isolate and keep people abroad who are, for instance, our sons and daughters who might be studying abroad, our family members who have worked abroad. We need to bring them home, too. That just needs to be done in a very careful way.
But if it were a domestic issue, that is, cutting down flights from, say, New York to LAX, would you entertain that?
Look, I will follow the advice of public health professionals on this. There are critical workers that are coming from places. I think this is about screening and making sure that people know before they're getting on a plane they be screened. If the federal government could help us in all of our airports do that before people get on planes with temperature guns and doing that as people get off of them, then I think you can still have flying. But short of that, I'm absolutely open to that.
Thank you.
Thank you. Next question.
Next, we turn to the line of Claudia Prosciutta with KNX News Radio.
Hey,
Please
Claudia.
go ahead.
Hi, Eric. Two questions for you. Some counties up north have already extended their stay-at-home orders until May 3rd, and if I remember correctly, I think LA goes until April 19th, so I'm wondering if you are planning to extend that now into May. And also, some of the Reclaiming Our Homes people say, families that have taken over some of the vacant state-owned homes in El Torino are having their utilities shut off by LADWP. Would like you to comment on that. Thank you.
I'm not familiar that there were homes that had utilities actually on, so let me follow up on that. I don't know the details of that one. In terms of when the order would end, absolutely, you can count on it going longer than April 19th. That's what it is today. We're going to continue listening to public health professionals, but none of them have given me any indication that that's the day that it will be lifted. That's what it is today. We'll continue consulting with them and doing that together with Los Angeles County, but we can expect it to go into May for sure. Next question, please.
And next we turn to the line of Steve Gregory.
Oh, sorry, let me say one other thing.
Your affiliation and your question.
Actually, before your question.
Hi, Mayor.
Okay, go ahead, Steve.
Good evening.
Yeah.
Yes, I wondered if you have any new numbers from enforcement with your crisis response team and business ambassadors. Also, the question had come up earlier about the names of the businesses that were being referred for charges, but you said you couldn't tell us the names of the business. Can you tell us what types of businesses they are, sort of give people a sense of the types of businesses that are still staying open? Also, has anyone in your administration or your office yet tested positive?
Not that I know of, not in my office or my administration, not that I know of. We were asked yesterday about the Los Angeles Fire Department, Police Department. I can give you those numbers. We have 8 members of the fire department who have tested positive, including 1 civilian, 7 firefighters. 2 of those are already returned to work. And LAPD, which has about 10,000 officers and a few thousand civilians, 32 is the number there as well. In terms of the business enforcement, no, it's just that I don't know the particular ones. I was given those numbers just on the way in, so it's just that I don't have the knowledge. But I'll see if we can follow up tonight and give you any details about the types of businesses that they are. We have had 8 referrals was the number now, 4 more today and 4 yesterday. And we have visited now, I think last night it was 150 or so. It's probably been about 300 visits that have been done by these ambassadors and by LAPD.
Now, you were talking about first responders who have tested positive. Mm-hmm. Anyone in your administration on the
I started with that
office side or anything like that?
No, I started with that saying no, and then I added, just for your benefit, also the first responders. So no.
Okay, I'm sorry. It's very hard to hear.
No, don't worry. I know it's tough too. And I wanted to say one last thing on Claudia's too, just to go back to the folks that are looking at those homes. I want to say this, that the 710 homes that are there, that the state will, potentially with our housing authority or somebody else, allow us to be able to take those homes and be able to turn them into affordable housing. There is a housing crisis. I'm sympathetic to the idea that there are people who don't have homes and we have these empty homes. So that is something that the state owns. Metro helped pay for with Caltrans had helped pay for. But we shouldn't, at least on the LA City side, I'd love, and I've been talking to State Senator Maria Elena Durazo, others about the possibility of that, former State Senator Kevin De Leon, who's going to be the incoming council member in that area. I hope that the state will look on that and maybe give it to us, if they can legally, for $1 or something for our housing authority. And LAPD, I'm sorry, correction, it's not 32. It's just been updated because we get that a couple minutes before we come in here, 33 now, of about those 10,000 officers and a few thousand civilians. Next question.
And next we turn to the line of Alex Michelson with Fox 11 News.
Hey, Alex.
Go ahead.
Hi, Mayor. I want to talk for a moment about the issue of masks. It's going to be quite a surreal sight to see the second largest city in America with everybody wearing masks. Just talk about the surreal nature of this. And a lot of people are also wondering, why now, when we could have maybe done this 2-3 weeks ago, would that have been safer?
I've been waiting for the advice, and I think there's going to be some forthcoming advice in the coming days from our state and local officials, but they've been waiting on the CDC. I finally said today, I don't want to wait any longer. I've certainly asked folks who've asked me casually. I've looked at the research. Most places that we see that use them, they're either good for reminding us to control our behavior and just keep the distance, and as folks have said, obviously, the size of the microns of a virus is smaller than the pores that are in here. But somebody once had a good metaphor they shared with me. Imagine that a micron, this virus, is the size of a football player. and the masks have holes the size of a door. Maybe that football player can get through a door, but imagine 4 or 5 football players trying to rush through the door at the same time. This can be effective in keeping them from going through. And anything that can even be 1% effective, 10% effective, 50% effective is something we should do. So I would hope that the CDC will move forward with that. I was looking at other governments this week in other countries who have had a tradition of this, and I think it is time for us to do this. And I know it will look surreal. We don't have that kind of cultural tradition of wearing masks. We associate that with other parts of the world. But those parts of the world started to do that because of some of the health scares that they have been through in the past. So this is something that I would encourage people to do. It's something you can do at home. There's plenty of how-to guides online. And we're going to have to get used to, seeing each other like this. Excuse me. This will be the look. So let me lead as mayor and let people know this is how we're going to be seeing each other. And wearing these on the streets is something that will help us all control that spread, and most importantly, when we go to the grocery store or something, keep those frontline workers from getting sick. Next question, please.
And next we turn to the line of Sarah Nelson with UCLA Daily Bruin. Please go ahead.
Hey, how you doing?
Hi. I'm Mayor Garcetti. I was just wondering, in terms of healthcare workers, what are you doing to help them or give them resources, for example, with daycare or groceries? I know that there are groups of medical school students here at David Geffen School, for example, LA COVID-19 volunteers who are making face shields, masks, and also helping make surgical gowns and distributing them to local organizations. And I was just wondering if you could help them or if you had any comment on that.
Absolutely.
And as far as testing with UCLA Health, how many tests are they running per day at this time?
I don't know. You'll have to ask UCLA that. And one of the problems nationally is trying to get testing information. The positives have to be reported to LA County Health. So we get the positives, but we don't get necessarily the negatives and the number of overall tests. So you'd have to refer that question to UCLA. The tests that I'm talking about are ones that the city of LA is running, and now starting today, LA County, and we hope to continue getting those statistics for you. In terms of helping medical personnel, so much, and thank you for that question, because we care so deeply for those folks, and we're seeing in other cities just how much they're putting their own health on the line, making sure that we are healthy. Everything from, as I was mentioning before, manufacturing protective facial gear, face shields with some of our local manufacturers. Yesterday I was talking about, and a couple different nights I've talked about how we've taken the man who runs our port in Los Angeles, the busiest container port in the Americas, Gene Soroka, and made him the chief logistics officer. And he is now consolidating what hospitals tell him they need, what our first responders say they need, and other frontline workers to get masks, to get personal protective equipment. And then third, we're working with local industry as well. So they are ones that are able to help us, whether it's hospital equipment or whether it's some of the protective gear that our professionals need. And I want to highlight, as I mentioned, so many volunteers around the city that are doing things. I mentioned, I think, Eric Spiegelman, the Masks for Docs. If you go to hashtag Masks for Docs, people are taking 1 or 2 of these out of their earthquake kit, or construction workers who don't need the 100 that they have are saying, I've got them, and a motorcyclist is going across town, picking them up, keeping them secure, and dropping them off where a nurse or a doctor has said, it looks like we're all out tonight. So we are trying to help those sorts of efforts and matchmake while we buy and procure the thousands, the tens of thousands, the hundreds of thousands, and ultimately the millions of those masks. And I want to underscore what I said. Do not make a run on these. We need these to be in our hospitals. We need these to be with our frontline workers who are doing things like testing. We do not need them when we are going out to shop. But this is for that. Thanks so much for the question. Next question, please.
Thank you.
And our final question in English comes from the line of Robert Kovacic with NBC News. Please go ahead.
Hey, Robert.
Hi, Mayor. Good. I'm sorry to bother you again, just to follow up for us here. There is some confusion that people have alerted NBC4 about regarding restaurants turning into grocery stores, using those sales to try and get by.
Yes.
Some of them are still being shut down by LA County. Is there wiggle room for these restaurants to do that, and how do they proceed?
It's permitted now, so that might have been a couple days old. I think it was yesterday that they switched that. We certainly impressed upon the county that we thought this was an appropriate thing for restaurants to be doing. They heard other folks as well. They looked at that, they reconsidered. So that guidance went out just yesterday. So if it was before that, perhaps there was still enforcement. Now, there's other enforcement that obviously the public health department can do if you're violating other parts of their orders. But if you're doing takeout or delivery, those are the ones that are allowed to do it. So you can't just open up your shop and...
Things that just went into enforcement, how is it going with the new business protocols for construction sites? Have you received those that have put in applications and are willing to comply?
Absolutely, and today we had inspectors out there throughout the entire city, and they will be visiting every work site. And we appreciate people who have brought to our attention work sites where they think people are not complying. Again, that information is really useful, but we will be going to each one, making sure that they have COVID-19 training, they have somebody who's a supervisor on that, and that they have PPE and are maintaining the proper distances. So it went very well today. Thank you.
Thank you, sir.
Okay. So with that, I will turn to Spanish. Thank you all again for tuning in. For those of you who are tuning out, I wish you a good evening, and we'll wait for our great interpreters to switch out. Muy buenas tardes, Los Ángeles. Hoy empezamos un nuevo mes y va a ser un mes difícil. Hoy en el condado de Los Ángeles hubieron 507 casos nuevos de COVID-19, llegando a 3,518 casos totales. Esto significa que desde el viernes el número de casos en el condado de Los Ángeles se ha duplicado. En nuestra ciudad hubieron 194 casos nuevos, llegando a 1,580 casos en total. Y desafortunadamente fallecieron 11 personas más en el condado. En total hemos perdido 65 vidas. Y lo siento a las familias por su perdido y por su tristeza también. Seguimos aumentando el acceso a las pruebas de detección. La semana pasada tuvimos 4 sitios de pruebas y hacíamos 1,000 pruebas al día. Esta semana tenemos 9 sitios y hacemos 2,000 pruebas al día, gracias a la colaboración del condado. Por favor, visita la página coronavirus.lacity.org para ver si eres elegible para hacerte una prueba. Todos queremos detener la propagación del virus, con practicar la sana distancia y quedarnos en casa, y ahora con coberturas para la cara. Por eso, junto con la guía del gobernador Newsom y la doctora Ferrer, la ciudad ahora está recomendando que lleven coberturas en sus caras cuando están en público o con otras personas. Estas coberturas pueden ser bufandas, pañuelos o algo hecho en casa, pero lo importante es que no deben ser mascarillas N95, las cuales son para proteger las vidas de nuestros médicos y enfermeras. Y LA Protects, nuestro programa, nos puede ayudar con esto. Seguimos adelante con la ayuda de todos y la industria de moda de Los Ángeles está presente para ayudarnos. Hasta ahora, 400 compañías de ropa se han registrado para hacer coberturas para las caras y 147 son elegibles. Tienen licencia, están localizadas en la ciudad de Los Ángeles y están de acuerdo a cumplir con prácticas de protección para sus empleados. Con ellos tenemos la capacidad de fabricar más de 2 millones de coberturas para caras cada semana. Y con 99 empresas esenciales que ya han pedido estos productos, LA Protects nos está ayudando a cuidar a las personas quienes nos están cuidando a nosotros. LA Protects nos muestra lo que pasa cuando toda la comunidad, incluso el gobierno y el sector privado, se unen en acción. Estoy también orgulloso de anunciar que nuestra comunidad de diseñadores y arquitectos se está movilizando para imprimir equipamiento para proteger a nuestros trabajadores médicos como protectores para sus caras. Si estás operando una empresa esencial o si trabajas para un proveedor de servicios médicos y necesitas coberturas para la cara, registrarse en coronavirus.lacity.org/LA Protects. Estamos haciendo todo lo posible para ayudar a pequeñas empresas durante esta crisis. Por esto tomé acción para mantener abiertos a nuestros mercados de agricultores mientras protegemos al público. Estamos obligando a los mercados a someter un plan de operaciones durante COVID-19 a la Oficina de Mantenimiento de las Calles. Hasta hoy hemos aprobado a 11 mercados de agricultores en nuestra ciudad para continuar operaciones inmediatamente. Cada plan debe implementar medidas para proteger a vendedores y clientes para no ser expuestos al virus. Si su mercado todavía no está en operación, visite la página specialevents.lacity.org/home. También tomamos acción con el condado para permitir que restaurantes puedan también ofrecer productos comestibles en sus menús para llevar. Aunque no puedan aceptar clientes en sus restaurantes, esta forma de innovación en este momento les ayudará a sobresalir. Todos debemos hacer nuestra parte, pero si no cumplen con la orden, más protegidos en casa, están poniendo a vidas en riesgo. Esta noche estoy dirigiendo al Departamento de Agua y Energía a que desconecte los servicios de agua y energía para empresas no esenciales que siguen en operación. Nadie quiere hacer esto y no lo haremos si simplemente cumplen con la orden. Cada día veo cómo se están uniendo todos en esta lucha. Personas como Bruno Vázquez, quien donó $5 al Mayor's Fund y escribió: quería ayudar a personas quienes no tienen acceso a dinero. Yo tengo mi propia empresa, no es mucho, pero espero poder donar más. Bruno nos recuerda que estamos aquí para cuidarnos el uno al otro. Sabemos que con cada acción podemos ayudar a salvarle la vida a otra persona. Nuestros destinos están unidos en esta lucha y por eso le pido a todos, quédense protegidos, quédense en buena salud, quédense en casa. Fortaleza, fuerza y amor. Gracias, Los Ángeles. ¿Y preguntas? First question. Thank you.
First question, please.
And our only question from Spanish comes from the line of Leon Krause with Univision, Channel 34, Los Angeles. Please go ahead.
Hola, Leon.
Mayor, good afternoon. You have said that it is now required to wear either a face mask or some sort of protection when going out in public. Could you elaborate for our audience? ¿Ha dicho usted que ahora será necesario usar mascarillas o algún tipo de protección facial al salir a la calle? ¿Podría explicarlo mejor para nuestra audiencia, por favor?
Sí, por supuesto. Hoy estamos empezando a recomendar que el público lleve coberturas en sus caras si salen en un lugar público. Esta es protección no solamente para ustedes, pero críticamente también por los trabajadores en nuestros supermercados, en nuestras farmacias y otros lugares que necesitamos ir. Esto es para evitar la propagación de este virus. En muchos países como Corea, Taiwán, en la República Checa, esta es la práctica y necesitamos adoptar Y tenemos muchas compañías que están haciendo estos y es diferente para nosotros, no es normal, pero estos tiempos no son normales. ¿Expectan a ver en su alcalde? Y con sus familias también. Gracias, León.
Gracias al alcalde Garcetti. Ahí nos explica exactamente qué es lo que hay que hacer ahora. Esta recomendación que en efecto se pone en práctica en otros países, ya lo decía el alcalde Garcetti, en Corea, en la República Checa es obligatorio, así que ahí está. Si sale usted en público tiene que usar mascarilla o algún tipo de tela para cubrirse.
Sí, tal vez es una posibilidad y quiere ver más aviso del centro CDC, el nivel federal, porque espero que será una política nacional. Muchas gracias, León. Gracias a toda la gente de Los Ángeles. Gracias por su tiempo, su valor y hasta mañana. Thanks everybody for your courage, and we'll see you tomorrow.